Kumbala Express TV ekitongole ekya Women with a Mission kino nno nga kirwanira eddembe ly'abantu abanyigirizibwa saako n'okuba nti kigezaako okuba nti kiyambako abantu abalina obukosefu naddala abafuna akawuka ka mukenenya. Olunaku olwali begasse ne bapartners eb'enjawulo ne basobola okuba nga ate batongoza olunaku olwa HIV AIDS. Bagamba nti abantu abalwadde b'ekirwadde kya mukenenya ebiseera ebisinga bafuna stigma oba okuboolebwa mu community, era ne bagamba nti singa nga abantu bano baba tebabudaabudiddwa obulungi okubudaabudibwa obulungi bandibanga ate bafuna obuzibu n'okuba nti bagaana n'okumira eddagala. Ensonga endala abantu bakoberezeddwa nti w'obanga ogenda kubanga ate weegatta n'omuntu gweteekakasa osobola okuba nga ate okozesa obupiira saako n'okuba nti abantu bakubiziddwa okukendeeza ku bwenzi, era nga waliwo ripooti okuva mu bantu ba Mbale City naddala abakungu naddala aba region eno ne Bugesu sub-region bagamba nti siriimu ayitiridde, naye kigambibwa nti abaana b'amasomero abasajja bano abakulu baava mu kugula bamalaaya abali ku nguudo ne badda ate mu kugula abaana ab'ama hostels naddala aba high school, ate nga n'abaana bano nabo bennyini bali willing okuba nga ate begatta n'abantu abakulu oba kiyite cross generational sex. So byebimu ku ebyo betugenda okuba nga ate tukutusako wano ku Mbale Express TV. Ensonga endala yebimu ku ebyo okuba nti abakyala abafumbo ate baava mu bufumbo ne basobola okuba nga ate badda ku ma street bafumbo naye ate beetunda. So ezo zimu ku nsonga ezigambibwa nti ezimu ku ezo ziviiriddeko nnyo abantu okuba nga ate bafuna akawuka ka mukenenya. Tugenda kuba tukutusaako abakungu okuva mu Women with a Mission, abakulu ng'aba RCC, abakulu abatwa aba HIV focal persons n'abantu abalala bangi bagenda okuba nga ate boogera naffe wano ku Mbale Express TV.
But when we look at hostels, I must say that with our younger people who are staying in hostels, especially around Mbale City and in other rural growth centers of Mbale district, we are not doing well at all. They are young people. Sometimes we have had proprietors who are just doing business, but they don't care about the supervision of the young people. So sometimes they stay in a hostel, but some days they stay in, sometimes they stay out. Sometimes they are in, sometimes they are out, and nobody is controlling them. So we feel that I think is upon the administrations of Mbale City, Mbale district to see that they can be able to bring some of these proprietors to order, so that if it is a hostel, let it be standard hostel where young people have to be controlled, and most of them of course house girls. So definitely a girl child needs a lot of protection, and we hope that it shouldn't be left to whom it may concern. In Mbale now, most people have turned around now. They want to go and buy the young people who stay in hostels because they have needs. They no longer now go to buy the women on the street. Instead, they go to look for the girls in the hostel because the girls in the hostels are cheaper. It's just buying something small and then they will buy some good shoes and they will take. So we want to ensure that our hostels have good supervision. Parents have to take their responsibility of following up their children to see if children are staying in hostels. Are these hostels safe? Otherwise, we have had parents who just know that their children are in hostels when actually they are staying in people's homes. So this is one of the issues causing a lot of infections in our young people. But of course, you know very well that these days there is also the coming of the married women who also do business. Sex business. A married woman comes, goes to town, goes to a guest house, and does business and gets back home. So, and most of them, our people here, adults, 50% of the people who are having multiple sexual partners are not using condoms. 50%. So, meaning that a number as big as 50% not using, then meaning that we might not achieve our vision for this country ending HIV by 2030. So we want to appeal to our people to use condoms to protect themselves and use condoms consistently. Otherwise you find somebody is having 3, using on 1, not using on 2, using on 2, not using on 1. So for us we say you are not using condoms at all. Meaning that you have to be protected at all times, and this is the advice we give our people. Our young people, we tell them please, not until you are ready for the consequences. Don't go into sex. abstain, go to school, finish school, and then you can get back when you have a better head to make a decision, then you can go into that. For our young people, as Robert, I'm the HIV AIDS program coordinator Mbale.
By the names Nabagus Ali, the Mbale district PLHIV coordinator, doubling as the regional coordinator Nafafano, National Forum of People Living with HIV. Yeah, today we are commemorating the World AIDS Day, trying to give out information on HIV. And as we say currently, we are not doing well as a community of persons living with HIV. Of recent, services were disorganized, were disrupted by the stop work order. And at the moment, services are not moving on well. So we are calling upon various implementers to be able to support communities, so that I know communities can do well, especially contributing to the fight against HIV. So currently, we are not doing well. I know HIV, when someone tests for HIV and begins treatment, when someone is put on treatment consistently, someone cannot infect. But with these recent disruptions, it has disrupted medication, and I believe things are not moving on well. So we are calling upon the partners to work hard to see that they can work with the communities to be able to support persons living with HIV. And treatment of HIV cannot be successful alone, not until we add on some social services like counseling, follow-up, and other services that may support persons living with HIV. So I remain Abugus Ali, the coordinator person living with HIV. Thank you.
I'm Tony Caroline, the board chairperson, Women with a Mission. With the young, we are working with the young girls. We have a project under Her Voice. We create awareness among the young girls. We educate them about their body autonomy. They have the right to the choices that they make. So we avail them with the different information on HIV so that they can stay safe from the scourge of HIV.
Why do some of the people fall into the traps of HIV? Is it because of poverty? Is it because of unawareness? Is it because of peer influence? According to your research as an organization.
Poverty has been the leading cause because the information is there. The different partners have worked so hard. Information is disseminated all over, but it's the love for material things that is landing the young girls into HIV, into catching the virus. Yes.
What are some of the challenges you face as you embark on joining government with HIV by 2030? And how would the government also assist you in one way or the other, make sure that your mission gets complete?
It's basically in the communities, the attitude. People have their own beliefs. So it is, we need to work harder to the grassroots. We still need to work hard towards availing the people with that, with the right information on HIV, because they still have their beliefs on how HIV is contracted. So information is key. As an organization, we want to request the government that more information, we go to the grassroots and avail people with the necessary information on HIV. Yeah, for attitude change to be worked on.
My name is Nekesa Gloria Clara, a young person working with Mbale Network of Young People Living with HIV and also a co-founder, support TASO as an AGYW to ensure that the voice of the adolescent girls in the communities, I represent them to another level. how we finding integration since the donor card fund. There is a lot of stigma in facilities whereby they've brought some people at the facilities whereby there is some knowledge gap. They don't know how to handle young people. So this is a young person who has come to access services like sexual reproductive health services like condoms, whereby this young person, they're mixing them with the big people, which will cause a lot of stigma. And also there is a limited resources. At first we had the adolescent and young people. These are youths who have been supporting us. This is the program. Which was put by the Ministry of Health to ensure that these young people at the facility level support us in delivering services like counseling, ensuring that these young people give counseling on adherence, homo visits, and ensure that these young people who are already on treatment don't miss their appointments. So when the integration came in, there is a lot of gaps which we call upon the government, the district, to ensure that we cover up these gaps and also to ensure that we achieve the 2030 goal. Thank you.
I am called Wamalwa Augustine. I'm a minister in Inzia Masava, representing Office of the Omukuka. I am really happy to be here today, and most especially to address our people in this nation, and most especially on the side of the young people. This morning we had very wonderful activity where we were able to move around, trail, sensitizing the community on the best ways on how they can manage the HIV AIDS program. There has been really a lot turn up of the young of people, most especially to attend such kind of events. Today I want to encourage people outside there, whenever such programs come on board, let us come up and support these initiatives, most especially as we talk about the HIV AIDS, which is actually among the young people within in Bugis region is so high.
My name is Masaba James. I am the Social Services by the local government, and on this function I'm representing my LC5 chairperson, Mr. Mafai Muhammad. We want to take this honor to thank organizers of this function. As my district, we feel such functions help us to get a platform to address the nation about how far the district has gone in trying to fight against HIV, stroke AIDS in Mbale and Bugis at large. We take it such moments where we gather together and we interact as very important moments because they help us to reflect on how far we have come as a nation and also how far we have tried as a district to ensure that we spread the message about HIV, stroke, AIDS, prevalences in the Eastern, and also we try to give an accountability of what we have done so far as a district to ensure that we fight the virus. As we may be aware, all of us, HIV prevalences are still high, and especially in Eastern is worse because of our cultural beliefs and norms. For us here as Bagisu, when it comes to that period of Imbalu, it's like everyone is now free to participate in whichever sexual activities in the region. So because of that, you find that many people in that process of celebrations, they end up contracting HIV, and that's when we see prevalences go high. As you may be aware, Bugis region is one of the regions that are increasingly being affected by HIV, stroke, AIDS prevalences. So as a district, we join our partners here and the rest of the world to commemorate on the World AIDS Day celebrations and, as a platform that gives us a basis to that gives us a basis to give accountability to our people of Mbale district and also as of Bugisu region. We are there to ensure that we spread the message about HIV. We really see that there's a very big gap. So I call upon the government to put more emphasis in fighting HIV by sending us enough money to the district to help we do certain activities that can help us to address the issues of HIV. This whole function you're seeing here, it is through partners. Partners are the ones that have been behind all these organizations. As a district, we didn't have even a single coin to contribute, apart from availing ourselves and also mobilizing people to come and be part of this celebration. So as a district, we really want to appeal to the government of Uganda and to Uganda AIDS Commission to allocate enough resources in fighting against HIV at local governments. Because the money that they give us as 0.0% of the budget, it is realized from the local level, which might not come to the target as you had planned. So we call upon government.
Janet, Assistant RCC, Industrial City. I'm here on behalf of my office of our Resident City Commissioner.
It is a long story.
And as you know, HIV affects all of us because health is the key to everything. And according to us, we are glad that we have the AIDS support center around in the city. It has really done a lot, and the government is always willing to support where need be, because they are the ones who have the measures of sensitization, and it has really done its part. And we believe that by 2030, AIDS, if with all the combined efforts, by 2030, AIDS will be no more. On behalf of our kids, we know the government has put in a lot, because in schools at least there is a teenager sensitization. These people are given a chance to know what AIDS is all about, and they know that AIDS is real and it kills.
Ndihuba bolereni yimuhole bamasaba mupimisi bamasaba kuliabe nambe ngali bamasaba kusala nabi ne kufukirisa huri mumbuke fiti esi hubiri nine yeyi lero wero wakuambira holi mulamu yipimisa uche wakamise byesu hola lero ta ngo wabonori wafuna kawuha siri lwakamero wota ke bahuwe kamalesi kaliwa kamalesi no hakunyori nga bahuwe kamalesi uba wawoniye nenga bahuwe kamalesi ubera bera bahuwa kamalesi werosera hukenda shuvavita kale message wa mumba masabero meri yimuchunge muchende bulayi kubone huruhu kurwanisa bulwale bulyo bo mukenenya kubulanga huri muniafu chinu shikali nabi mwanyara nabi.
Manana Henry is my name, Assistant Head at DC Mbale District. I was invited to be part of this function ongoing, and I want to express my pleasure for the partners who have partnered to have this function be what it is today. The government of Uganda has done a lot, enormous, in response about HIV AIDS. In the first place, what you are seeing here is a testimony of what the government is doing by way of attracting so many partners in the fight against HIV AIDS. As you can read for yourself around, there are so many partners in this fight against HIV AIDS. But you know very well that these partners cannot be here without government. So government is aware that in our budgeting, we have gaps. We cannot able cover each and everything. So what government has done is to attract as many partners as possible, like you've seen them here, to ensure that they combat the spread of HIV AIDS in Uganda. Now, the president himself is a role model in the fight against HIV AIDS. And the vision of the country today is that we should not have any new cases of HIV AIDS by 2030. So that tells you how much Uganda is committed in response or in the fight against HIV AIDS in this country.